Do you have a lower belly pooch that won't go away no matter what you do? Then watch this video. Today, I'm addressing a common problem that many of us face, myself included. That pesky lower belly pooch that won't go away no matter how much you diet and exercise. Well, I've got some insights for you and some exercises to share. So stick around till the end to transform your core game. What is upper ab dominance? So this refers to overgripping with the upper abs, and it can put tremendous downward pressure on the pelvic floor. This can come from dysfunctional breathing patterns and from not recruiting the TVA correctly. It can cause head and neck tension, back pain, difficulty taking full deep breaths, and pelvic floor issues. Let's do an anatomy review of the core. The core is like a can of soda. The top of the can is the diaphragm, which is a significant muscle in the breathing process. The bottom is the pelvic floor, and the sides are your deepest abdominal muscle, the TVA, the transversus abdominis, or the transverse abs. Now, all of these are muscles, and we need to connect to them if we want better spinal stabilization. The more you can stabilize your spine, the better your movement patterns will become. If you have improper breathing mechanics and really weak deep core strength, it can lead to problems like hip tightness, piriformis syndrome, IT band syndrome, back pain, sciatica, and SI joint pain. Now, most people don't know how to engage their core properly, and they end up bearing down through their upper abs, or holding their breath, or they just suck in their tummy. And this puts downward pressure on the pelvic floor, which can cause issues like urinary incontinence, pelvic organ prolapse, and that lower belly pooch. So how do you activate the lower abs, the lower TVA area? First, take a look at the TVA. It's your deepest abdominal muscle. On top of it, you have your internal and external oblique muscles. And on top of those, you have your rectus abdominis, your six-pack muscle. So imagine your TVA as a corset encircling your waist. So to activate the TVA, the first step will be activating the pelvic floor. Here is the pelvis and the pelvic floor. You can see it's like a bowl. And here are the openings, the anus, where you go poo, and the vagina, and then the urethra where you go pee. First step to activating the pelvic floor is squeezing these openings and lifting them. And then you're going to release the openings. Now let's focus on activating the lower abs, particularly the TVA. A simple way to activate the TVA is by coughing. So place your hands around your waist and cough and feel the TVA pull in. This exercise provides a sense of contraction, and it gives you a sense of how to engage the TVA when you're breathing. Now put your hands on your low belly and do this exercise with me. Inhale, allowing your ribs to gently expand, creating space for your lungs. Exhale and feel your lungs getting smaller and the TVA pulling in. You can feel the belly pull in gently. It might help you to pretend you're blowing through a straw on the exhale. So try it again. Inhale. Exhale. This breathing exercise is a simple way to exercise the low abs and relieve stress. It also helps with the lower belly pooch. Does upper abdominance cause a belly pooch? Yes. This occurs when there's a lack of emphasis on engaging the pelvic floor and TVA. Instead, there's upper abdominal engagement. Initiating the core engagement from below can prevent dominance of the upper ab muscles and that downward pressure. So you want to engage the pelvic floor first and then the low abs. And that's why you often hear the cue, zip up your core, because you're zipping it up from the bottom. So try it, put your hands on your upper abs. That way you'll know if you're keeping them soft and relaxed. And then exhale and zip up your core. This is hard, especially if you are a notorious upper ab gripper. So if you don't get it at first, keep practicing. So let's recap. It's essential to establish a connection with your pelvic floor and initiate engagement from the lower muscles. So practice proper breathing. This approach will prevent undue pressure from the upper abs, and it'll promote overall core strength. Do you breathe wrong? Mastering breathing is crucial for a strong foundation in any fitness journey, but it seems so lame and people don't want to work on breathing. So I ask them these questions. Do you have any tightness in the neck or the front of your chest? Do your shoulders round forward? Do you ever get numbness in your hands, especially when sleeping at night? Do you suffer from urinary incontinence? Do you suffer from back pain and hip tightness? Do you have an anterior pelvic tilt and or rib flare? Do you have a lower belly pooch or a diastasis recti or pelvic organ prolapse? If you answered yes to any of these, then you need a breathing intervention. If you have pelvic floor issues, you need a serious breathing intervention. Why? Because breathing impacts pressure on the pelvic floor. If you overlook breathing and advance with your exercises, this can lead to pain, pelvic floor issues, and diastasis. Next, I'm going to discuss breathing mechanics because breathing is our foundation for great pelvic floor and core functioning. So let's talk about breathing. Well, it isn't just having air travel in and out of your nose, and breathing isn't just about filling your belly with air. You were probably taught to belly breathe, and I'm not a fan of purposely trying to distend the belly a lot. Rather, breathing is about achieving a balanced 360-degree expansion, which means you're also inhaling into your back and your sides, not just your belly. So the diaphragm goes all the way to your back. So just focusing on the front isn't going to be getting the back diaphragm expansion. Done properly, breathing helps to release tension. Nasal breathing activates your parasympathetic nervous system, which makes you feel like you're getting a nice warm hug from grandma. Sit back in a chair and place your fingers underneath the edges of your rib cage and take a big nasal inhale down for me. Connect to what your diaphragm is doing. Feel it push out on your fingers. So it contracts and it moves down when you inhale so that your lungs will fill up with air. This is very active. Now exhale for me. So the diaphragm moves up when you exhale and the air moves out of your lungs. This is passive. So the goal is to use the recoil of the diaphragm back to its resting position for a very natural and relaxed exhale. When you exhale, don't contract your upper abs. So contracting the upper six pack and the external obliques can be a big issue for generating too much pressure down on the pelvic floor. It can contribute to tightness, leaking, and prolapse symptoms. Plus, it creates the lower belly pooch, and it doesn't create a great environment for diastasis healing. It typically creates a lot of neck tension as well. Make sure you don't cut your exhalations short. You want to fully exhale the air out of your lungs. Now, failure to do this will keep you in a hyperinflated state, and this can lead to issues such as rib flare, an anterior pelvic tilt, and a lower belly pooch. So the full exhale, it sets the stage for a proper inhalation. So now let's talk about pressure. So when you inhale, your lungs obviously fill with air, and yeah, that creates pressure. Now, not all pressure is bad. Pressure is what makes the pelvic floor stronger, but pressure down is a prominent factor in tightness, leaking, and prolapse. So pressure management starts with how you breathe. So breath can be used to help relax the pelvic floor. So let me do a recap just to solidify the concepts before we move on. So what does great breathing look like? It's 360-degree breathing. So great breathing is balanced. So you're going to get some belly movement, but you're also going to get expansion in your sides and your back. So that goal then is to get 360-degree expansion of the diaphragm. So when you inhale, you're going to inhale down, the rib cage is going to move out, and pressure is going to move in a 360-degree fashion into your belly, your back, and your sides. As you know from science class, air and pressure follow the path of least resistance. So when you inhale, your air and pressure are going to go to the path of least resistance. And maybe for you, that might be up into your neck or your shoulders, or maybe it's all in your belly. So we need to even out these paths of resistance. So the goal of breath work is getting air moving down, the ribs moving out, and pressure moving in a 360-degree fashion into the belly, the back, and the sides. Now I'm purposely going to get you to do belly breathing. So take a really big belly breath where you don't let your rib cage move at all. So I want you to send that air and pressure down to the front. Now take a moment to feel how much pressure is directed down into your pelvic floor. So if you have diastasis recti, belly breathing is going to create downward pressure, and that doesn't create a great environment for diastasis recti healing. It's also not a great choice for women with posterior pelvic floor tightness, and that's actually what most women have. So you've probably been taught belly breathing. I was even taught that in physiotherapy school. But where are your lungs? Are they in your belly? No, they're in your rib cage. So let's use common sense and think about what is actually happening when we inhale. We are trying to fill up our lungs with air. And in order to do that, the rib cage needs to expand. So for decades, I followed the cue of expanding my low belly, and the result was a stiff rib cage, stiff pecs, mid-back tightness, a tight neck, faulty shoulder and shoulder blade mechanics. So if you're tight, working on 360-degree breathing instead of belly breathing will help. And I can vouch for that. It really helped me. Next, we're going to do another experiment, this time shallow breathing on purpose. So I want you to take a shallow breath. So breathe up into your neck and shoulders, letting your rib cage slide up. Notice how this limits the pressure that goes down on your inhale. But what comes up must come down. So the more we breathe up into our neck and shoulders, the more pressure we're likely to put down on the exhale. Women are significantly more likely to be in a shallow breathing pattern and send more pressure to their pelvic floor with a forced exhale. And this is the case for about 50% of women. And these women need a breathing intervention. We talked about this a little bit before. Bearing down refers to applying excessive pressure, and it can lead to issues like leakage and prolapse. So the pressure is coming from gripping or clenching the upper abs. So over gripping the upper abs can put tremendous downward pressure on the pelvic floor, and it can also create that lower belly pooch. Now, pressure isn't inherently harmful. In fact, pressure contributes to building strength and spinal stability. So the key is learning to manage that pressure effectively. So this involves being mindful of gripping your upper abs, especially during your daily activities. So I don't want you to fear pressure, rather I want you to develop the skill of managing pressure. So let's talk about the rib cage. So our rib cage is meant to move when we breathe. If it doesn't move with every single breath, then, well, you probably have chest, neck, and mid-back tightness. So this is a fun visual that has really helped me with the 360-degree breathing. So pretend you're a plastic water bottle that's been dented. And the only way you can fix these dents is from inside by inhaling and expanding. So fixing tight muscles, it's an inside job, and it boils down to your breathing mechanics. So let's talk a little bit more about ribcage expansion. So let's get your external intercostals involved in your inhalation. Place your hands on your ribcage and without shrugging up, do a nice big inhale. Get those ribs to move out to the sides. Can you feel the expansion? Now, do the ribs come back in on your exhale? Now inhale again. Do you feel some back and side expansion? It's really lovely. It's a nice back and side stretch. So getting the ribs to expand like that, it really helps to loosen up your tight muscles, including the notoriously jacked up QLs and psoas muscles. Now the psoas is a large hip flexor muscle, and it often causes back pain and tightness. Now the psoas, fun fact, it inserts up into the diaphragm. So if we inhale into our back with every breath, then the diaphragm descends effectively, giving the psoas a little massage. So let's get back to the reason why you clicked on this video, which is how to manage the lower belly pooch. But I mean, I don't want the focus to be just aesthetic. I hope you understand by now that if you have pelvic floor issues, urinary incontinence, back pain, hip tightness, prolapse, that you need a breathing intervention. As we've established, if you're one of these over grippers with the external obliques when you exhale, instead of using your intercostals, well, this is going to put a lot of downward pressure on your pelvic floor, and that could lead to pelvic floor dysfunction, such as leaking when you cough or sneeze, or it could cause a prolapse. So, learning to manage pressure is the number one thing that you can do to improve almost all areas of pelvic floor dysfunction, including the pelvic floor tightness. So the first exercise I'm going to show you is called Ha breathing, which is for pressure management. And I learned this from Dr. Sarah Duvall. And the intent of the exercise is to avoid generating that external oblique tension to prevent that downward pressure on the pelvic floor. And it can also help close a diastasis. Ha breathing for pressure management. The intent is to avoid generating tension from the external obliques to prevent pressure on the pelvic floor. This can help manage downward pressure on the pelvic floor, and it can also help you close a diastasis. So sit down comfortably on the floor. If this position is not comfortable for you, you can put something under your bum, or if this is still not comfortable, you can sit in a chair. I want you to let your belly relax and just hang out. So if you have a hard time just doing that, that's a sign that you're an ab gripper. So that's what we're trying to fix with this exercise. Put your hands on your rib cage. Naturally inhale without shrugging up, keeping your low belly relaxed. And now exhale with a ha sound. And you can use your hands to guide the ribs in and down. The external obliques are not engaged. So you want that belly to be fully relaxed. So you shouldn't feel any pressure down on your pelvic floor because you're not generating any external oblique tension. Now add gentle overpressure with your hands and inhale into your thumbs. Feel your sides and back expand, and then exhale with the ha. Keeping that low belly completely relaxed. So you shouldn't feel any tension in your external obliques. Now don't be too aggressive with the overpressure. When you do this exercise, do it for 5 breath cycles. Let's do it together right now. When you do the exhale, make sure it's a full exhalation. So here we go. Applying the gentle overpressure with your hands and inhale without shrugging up. Feeling the expansion into your sides and back. And then exhale and guide your ribs in and down. Here we go again. Full exhale, the belly's relaxed. And again. Again. Last time. There you go. So here are some more exercises you can do that'll help with the lower belly pooch. Now, for the first 40 years of my life, I had an anterior pelvic tilt. So when you have an anterior pelvic tilt, that will make the pooch even more prominent. So these exercises are going to help you reposition your pelvis. And I learned these from Dr. Sarah Duvall. So if you notice that your abs look more distended as the day progresses, or if they become more distended after a really challenging workout, then you're definitely going to want to try these exercises. When everything feels distended, here are some exercises you can do. So lean back into a chair. And we're going to relax our upper abs first because we don't want them gripping. So just give me a big inhale and then exhale a sigh. And let the upper abs go. Just let it all hang out. Let your lower belly hang out. Okay, we're going to inhale again. And this time when we exhale, we're going to scoop in our low abs. So here we go. Inhale. Scoop in the low abs.
without turning on the upper abs. Now we're going to hold it here for 10 seconds. 10, 9, 8. Relax here. 7, 6, 5, 4, 3, 2, 1. And release. Just let it sigh. Relax everything. Let's do that one more time. So give me a big inhale. Exhale and scoop the low abs. And we're going to hold that there for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Next, we're going to direct our inhalations into our side and our back. Give somewhere for that distension to go. So lean over, and we're going to do a big inhale. And feel the expansion into your hand and into your thumb. And then exhale, letting everything relax here. And again. And exhale. Relax. And again, inhale. Feel a nice stretch. It feels nice. And exhale, relax. Other side. Inhale, stretch. Feel it all the way in your back and in your side. And exhale, relax. And again, inhale. Exhale, relax. And one more time, inhale into your back. And exhale, relax. So I've been combating the pooch my whole life because I have the anterior pelvic tilt for the first 40 years of my life. So I'm going to show you 2 exercises that have helped me. So if you have something you can hang on to, get into a low squat if that position is available to you. So this is what it looks like from the front view. So my arms are stretched out long and I'm getting a nice stretch in my shoulders and my mid back and my low back. And I'm going to do a big nasal inhale and direct it to my mid back area. And then I'm going to exhale, sigh, and relax my upper abs. And again, big inhale into the back. And exhale. And in this position, it's easier for me to draw my lower abs in when I exhale. Let's do it again. Big inhale into the back. Feel a nice stretch in your mid back. Exhale. Relax in the upper abs. One more time. So this is a really great pelvic repositioner. So if you have an anterior pelvic tilt, you're going to really like this one. And I'm going to show you another one that will help you reposition the pelvis. I'm in the quadruped position. Look at my foot position on the wall. So I'm going to pretend to yank my feet up the wall, and that instantly turns on my proximal hamstrings, my inner hamstring area. Don't squeeze your glutes for this. So the entire time, pretend you're dragging your feet up the wall to keep your hamstrings engaged. And give me a big inhale into your mid-back. Feeling a nice stretch. And now exhale. And again. So try to relax your upper abs and feel the lower abs scooping in. And again. Last time. Stand up and see if you feel better with your pelvis. I spent decades in an anterior tilt and being an upper ab gripper. So trying to relearn the patterns, it takes practice. So practice.
All right, there you have it. So if you found these tips and exercises helpful, then please give this video a thumbs up and comment below with your thoughts and your questions. And if you have back pain, check out my free emergency back pain recovery kit. I'll link that below. If you would like to say goodbye to the limitations that back pain and stress incontinence may have imposed on your daily life, then check out my Core Solutions program. I'm offering an exclusive 2024 New Year sale, so act fast and take advantage of this limited time coupon HNY20. And of course, if you want more exclusive fitness insights, make sure to subscribe to my channel. Thanks for tuning in and watching all the way to the end, and until next time, keep working towards that strong and balanced core. I'll see you in the next video.